My name is Jayme Stokes, and I'm a general and bariatric surgeon here at Novant Health, and specializing in the treatment of patients with obesity, morbid obesity, and the comorbidities associated with such. So we're looking for patients who have tried all the other things. So diet, exercise, lifestyle modifications, maybe even some of the medications, certainly the newer ones on the market now, and either have had success and lost that success, or maybe didn't have the success that they deserved. They're looking for a more permanent, robust solution, and that's where surgery can step in. So we offer 3 different operations here at Novant Health: the sleeve gastrectomy, the room-wide gastric bypass, and the single anastomosis duodenal ileostomy, otherwise known as the SADE. Each operation looks a little bit different on the inside in terms of their anatomy, and they have different variances in terms of expectations of weight loss after surgery. And each one can be suited to a patient depending on their past medical history or other surgeries they've had in the past. So a patient with diabetes or reflux, heartburn symptoms may be better suited for one operation over the other. Patients for surgery typically have a BMI of 40 or greater, and there are calculators on the internet where a patient can enter their height and their weight and get that number back for themselves. And it's not gender specific, it's just your height versus your weight. So patients with a BMI of 40 would qualify. And then patients who are treated for blood pressure issues or diabetes issues or sleep apnea issues can qualify with a BMI of 35. Sometimes there are circumstances where we may be able to qualify a patient with a lower BMI, but that would be on an individual basis and depending on a patient's insurance. Every surgery does carry a certain amount of risk. What I would say to patients about those risks are have a conversation with your surgeon and discuss the individual risk of that patient, but also the individual surgery. We're blessed in Novant Health that we have great outcomes and great success stories, and our patients have very little to low risk after these surgeries. After surgery, patients can expect to lose a certain percentage of their excess weight. Typically, we'll quote patients anywhere from 50 to 70% of their excess weight, and that's based on the operation that they choose, their gender, their age, what their starting weight was, and any other past medical history they may have on board. The really exciting times are in these surgeries is to see a patient back 2 months, 3 months, 4 months after surgery, and they're either reduced the number of medications they take for diabetes or completely stopped them altogether. Their hemoglobin A1Cs are normalized, they've stopped their blood pressure medications, they've stopped using the CPAP machines. And then we have the more subtle victories where a patient can walk further. They can enjoy activities with their children, their spouses that they couldn't do before. And those are really the wonderful moments that we have in the office, sharing those with the patients. Typically, surgeries require a one-night stay in the hospital. Some patients are fortunate they could go home the same day. That's a patient-specific decision. And then usually we tell patients for the first 2 weeks to take it easy. They might have a little soreness, they might have a little fatigue, a little tiredness, but that usually resolves pretty quickly. By the time we're seeing patients back at 2 weeks for their first post-op visit, most patients are back to a fairly normal daily activity. Some patients have already returned to work depending on what their strenuous workload is. Some patients may require another week depending on how heavy a workload they have. But it's usually a well-recovered surgery, and at 2 weeks we're already seeing patients anywhere from 15 to 25 pounds down. While some people would say that it's the easy way out, our team and our patients would absolutely disagree with that. It is not the easy way out. These patients undergo a full commitment before surgery to get ready: nutrition counseling, lifestyle coaching, mental health evaluation. There's a lot of work that they put into it to make themselves the best candidate going into surgery. And then they're undergoing an operation, which carries, all of the risk and issues that an operation carries for anybody. And then they have to put the work in for life afterwards. It's not just a one-time fix or a silver bullet. They do commit to a lifelong lifestyle changes, lifelong commitment to nutrition changes, lifelong vitamin supplementation. And then we see them in the office for follow-up for life, 5 to 6 times the first year, and then every year after that, we want to see them back and celebrate their successes. Why I chose bariatrics is simple. We have a happy, celebratory office. There's nothing better than seeing a patient come back and telling us about the trips they were able to take with their family, or participating in activities with their kids, to see them reduce their medication burden or eliminate some medications, and just see the smiles on their faces, and to celebrate how much better they feel. And they bring in pictures and show us before and after pictures. So I like to say that we give out lots of high fives and hugs in our office, and there's no better place to work.